Welcome to the Burn Aid channel. Thank you for joining us. Today, we'll discuss how burns specifically affect pregnant women. Burn injuries during pregnancy pose unique risks to both the mother and the developing fetus. Let's explore the potential complications, treatment considerations, and preventive measures for burn injuries in pregnant women. Risks of burns during pregnancy. Pregnant women face increased risks when sustaining burn injuries due to several factors. 1. Physiological changes during pregnancy can affect how the body responds to burns. 2. Burns may lead to complications such as infection, dehydration, and shock, which can affect both mother and baby. 3. The immune system is naturally suppressed during pregnancy, making infections more dangerous. 4. Burns on the abdomen can directly impact the uterus, posing risks to the fetus. Complications of burns in pregnant women. Burn injuries can lead to several complications during pregnancy, including 1. Preterm labor or premature birth triggered by the stress of the burn injury. 2. Intrauterine growth restriction, IUGR, due to reduced blood flow to the placenta. 3. Increased risk of miscarriage or stillbirth, especially in severe burn cases. 4. The possibility of placental abruption, where the placenta separates from the uterine wall prematurely. Immediate management of burns in pregnant women. The immediate care of burns in pregnant women must be prompt and carefully managed. 1. Ensure that the airway is secure, and provide oxygen to maintain adequate oxygenation for both mother and baby. 2. Fluid resuscitation is critical to prevent shock and maintain blood flow to the placenta. 3. Monitoring the fetus is essential to assess well-being and detect any signs of distress. 4. Pain management should be tailored to avoid medications that may harm the fetus, with careful consideration of the risks and benefits. Treatment considerations for pregnant women. Burn treatment in pregnant women requires specialized care and considerations. 1. Wound care should be gentle to avoid further stress on the body and potential complications. 2. Antibiotics may be necessary to prevent infection, but the choice of medication should be safe for pregnancy. 3. The use of topical treatments and dressings should be evaluated for safety in pregnancy. 4. Multidisciplinary care involving obstetricians, burn specialists, and neonatologists is essential for the best outcomes. Monitoring the fetus after a burn injury. Fetal monitoring is crucial following a burn injury in a pregnant woman. 1. Regular ultrasounds and fetal heart rate monitoring can help assess fetal well-being. 2. Doppler studies may be used to evaluate blood flow in the placenta and umbilical cord. 3. Any signs of fetal distress, such as abnormal heart rate patterns, require immediate medical attention. 4. The decision to deliver the baby early may be necessary if the fetus is in danger. Psychological impact of burns during pregnancy. Burn injuries during pregnancy can have a profound psychological impact on the mother. 1. Anxiety and depression may arise due to concerns about the baby's well-being. 2. The physical and emotional stress of the injury can affect the mother's mental health. 3. Support from mental health professionals, family, and friends is vital during recovery. 4. Counseling may be beneficial to help cope with the trauma of the injury and the challenges of recovery. Preventive measures to reduce burn risk during pregnancy. Preventing burns during pregnancy is critical to ensuring the safety of both mother and baby. 1. Take precautions in the kitchen, such as using oven mitts and avoiding loose clothing near open flames. 2. Set hot water heaters to a safe temperature to prevent scalding. 3. Be cautious with hot liquids, electrical appliances, and heaters to avoid accidental burns. 4. Educate pregnant women on burn risks and safe practices at home and work. Long-term considerations for burn survivors during pregnancy. The long-term impact of burns on pregnancy can include ongoing challenges. 1. Scarring may affect the skin's elasticity, particularly in the abdominal area, which can be a concern during subsequent pregnancies. 2. Regular follow-ups with healthcare providers are necessary to monitor both the mother's and baby's health. 3. Nutritional support and hydration are essential to support healing and the healthy development of the baby. 4. Rehabilitation services, including physical and occupational therapy, may be needed to aid in recovery and restore function. Important notice: this presentation is for informational purposes only. Always contact a medical expert for treatment. Download the BurnAid app for free from the Play Store or App Store for more detailed guidance on burn care and first aid.